From the WBRZ investigative unit tonight, the former director of the LSU Student Health Center is suing the university, claiming she was wrongly terminated when she raised concerns about the office's partnership with Our Lady of the Lake. The woman claims the Catholic hospital forced their beliefs on health center employees and interfered with their ability to provide proper medical care to college students. Bess Casserly spoke to her attorney, who says there is a separation of church and state for a reason.
Well, Michael, attorney Jill Kraft says it's simple. Employees of a public university should not be bound by religious directives. She says when her client brought up her concerns, she was fired. For more than 2 decades, Julie Hooperich worked at the LSU Student Health Center, eventually becoming its director. That all ended this year.
She was threatened that, she needed to keep her mouth shut and ultimately terminated.
Her attorney, Jill Kraft.
She's a whistleblower, is what she is.
Says everything changed when LSU partnered with Our Lady of the Lake Hospital, taking control of the Student Health Center last year. As a Catholic health provider, OLOL required employees to abide by the ethical and religious directives for Catholic healthcare services, a nearly 30-page document laying out how medical services should be provided under Catholic doctrine.
However altruistic or good the motivation is that they think they're accomplishing, you cannot force state employees to accept a particular religious belief system, and that's what's happening.
Kraft says it affected how staff treated everything from mental crises about suicide to sexual wellness.
There's a huge section that talks about birth control, for example. And the stance of the Catholic Church is that birth control is only something to be used between married people. Sex is only to occur between married people and solely for the purpose of procreation.
The lawsuit says prior to the partnership, the Student Health Center provided counseling services for students facing gender identity issues, suicidal ideations, birth control, and pregnancy.
As you can imagine, with a student population, prescriptions for birth control or sexually transmitted diseases or prevention of STDs is it should be a big focus of, young folks who have become sexually active in college. But you take that out of the equation and make it more difficult for the providers to do their job.
Hooperich says the restrictions force providers to try and find a workaround at times.
Those providers were specifically told, why don't you just code it as acne or cramps in order to prescribe birth control? I mean, this is a state institution. And last time I checked, birth control is not against the law.
Also part of the lawsuit, the fact that student-mandated fees for using the health center were given to OLOL. Kraft alleges to defray operating expenses and reimburse some of its $40 million donation to the university. LSU did not get back to me when I asked for comment. However, after backlash from students when this merger was first announced, LSU said the university, not OLOL, would continue to handle reproductive health and services. According to Hooperich, the staff working in that clinic are all employed by OLOL. OLOL also declined to answer any questions, but sent a statement, which you can find on our website at WBRZ.com. From the investigative unit, Bess Casserly, WBRZ News 2.